Welcome to another video by my channel. In this video we will discuss displacement of lens. So let's begin. What is displacement of lens? It is the dislocation of the lens from its normal position. What is normal position? In the patellar fossa. It results from partial or complete rupture of the lens zonules. When suspensory ligaments are ruptured either partially or completely, then dislocation of the lens occurs. Here you can see dislocation of the lens. So what are clinico-etiological types? 1. Congenital displacements. These may occur in the following forms: simple ectopia lentis. In this condition, displacement is bilaterally symmetrical and usually upwards. It is transmitted by autosomal dominant inheritance. Then there is ectopia lentis at pupillae. It is characterized by displacement of the lens associated with slit-shaped pupil, which is displaced in the opposite direction. It is also associated with cataract, glaucoma and retinal detachment. Then ectopia lentis with systemic anomalies. For example, in case of Marfan syndrome, that is a connective tissue disorder. It is an autosomal dominant mesodermal dysplasia. In this condition, lens is displaced upwards and temporally bilaterally symmetrical. Systemic anomalies include arachnodactyly, spider fingers, long extremities, hyperextensibility of joints, high arched palate and dissecting aortic aneurysm. So in Marfan syndrome, these conditions are also seen along with ectopia lentis. Second cause is homocystinuria. It is an autosomal recessive inborn error of metabolism. In it, the lens is usually subluxated downwards and nasally. Systemic features are fair complexion, malar flush, mental retardation, fits, and poor motor control. So, in a homocysteinuric patients, these are systemic features. Diagnosis is established by detecting homocysteine in the urine, homocystinuria, by sodium nitroprusside test. Then third etiology is Veal Marshasani syndrome. It is a condition of autosomal recessive mesodermal dysplasia. Ocular features are spherophakia and forward subluxation of lens, which may cause pupil block, glaucoma. Forward subluxation of lens occurs into the anterior chamber and it causes pupil block, glaucoma. Systemic features are short stature, stubby fingers and mental retardation for this syndrome. Then we have Ehlers-Danlos syndrome, in which subluxation of lens and blue sclera are seen. The systemic features include hyperextensibility of joints and loose skin with folds. Then we have hyperlysinemia. Autosomal recessive inborn error of metabolism occurring due to deficiency of the enzyme lysin alpha-ketoglutarate reductase. It is an extremely rare condition occasionally associated with ectopia lentis. So hyperlysinemia is also associated with ectopia lentis. Systemic features include lax ligaments. So ligaments are lax, hypertonic muscles, seizures and mental handicap. So lax ligaments means lax zonular ligaments are suspensory ligaments and therefore ectopia lentis occurs. Then sixth is Stickler syndrome. Ectopia lentis is occasionally associated with this condition also. And seventh cause is sulfite oxidase deficiency. That is a very rare autosomal recessive disorder of sulfur metabolism. Ectopia lentis is a universal ocular feature. The systemic features include progressive muscular rigidity, cerebrate posture, and mental handicap. It is a fatal disease. Death usually occurs before 5 years of age. So let's recap this. Displacement of the lens is dislocation of the lens from its normal position. Normal position is patellar fossa. It is due to rupture of the lens zonules. Clinico-etiological types are 1. Congenital displacements, 2. Homocystinuria, 3. Veal Marshasani syndrome, 4. Ehlers-Danlos syndrome, 5. Hyperlysinemia, 6. Stickler syndrome, 7. Sulfite oxidase deficiency. So, thank you for watching.